Hello everybody. Today I'm going to be talking to you about neurofibromatosis. So a little bit on what neurofibromatosis is. To start, it's a genetic neurological disorder. It causes non-cancerous tumors to grow along the body's nerves and under the skin. Sometimes cancerous growths are possible to form. Neurofibromatosis can either be inherited from a paternal gene or it can come along spontaneously by a gene mutation. Two types of neurofibromatosis are NF1 and NF2. NF1 is found on chromosome 17 and NF2 is found on chromosome 22. And I'll get a little bit more into that in the coming slides. So next is causes of NF1 and NF2. NF2 is caused by mutations in the NF1 gene, which is found on chromosome 17. It can also be caused by mutations of healthy genes. And if you inherit it from somebody, typically you'll get it from a paternal dominant gene. And genetic changes disrupt the body's RAS pathway, which cause those tumors to develop. Causes of NF2. So NF2 is caused by the mutation of NF2 gene, which is found on chromosome 22. And chromosome 22 is responsible for tumor suppression. So once that gene becomes mutated, it isn't able to do that. And these mutations can cause the production of abnormal proteins, which then cause the production of schwannomas and other tumors. Some distinctions between NF1 and NF2. NF1 used to be called von Recklinghausen's disease. It's characterized by café au lait spots, which typically appear in a younger age and later turn into neurofibromas. NF1 is a lot more common than NF2. And then in NF2, it's characterized by tumors on cranial nerve 8, otherwise known as acoustic neuromas. And it can lead to hearing loss and vestibular issues by the ways of vestibular schwannomas. Schwannomas can develop in the cranial, spinal, and peripheral nerves, and NF2 is extremely rare. So next, the formation of neurofibromatosis in children. So it starts in early childhood with multiple café au lait spots, which to the right, those dark spots are those café au lait spots. Signs become visible by around age 10. Everybody's different, but 10 seems to be the most common age that you can start to see this. Spots increase in size and number with age, which then leads into freckling development under the arms and in the groin area. And then Lisch nodules appear in the iris of the eye, which in the next slide I have a quick picture to show you of that. And here's the picture of the Lisch nodules. The Lisch nodules themselves are the little brown spots that can be found all the way throughout the iris of the eye. So moving on into adulthood. So once those café au lait spots form, next formation would be the neurofibromas. Following that, tumors can also occur near the spinal cord. To the right is a picture of that. That big white mass is a tumor. And then also cancerous tumors are called malignant peripheral nerve sheath tumors. These can also form, but it's not as common as benign tumors. Symptoms now for NF1 and NF2. NF1 symptoms are, like we've already said, café au lait spots. Freckling in the armpits and groin, those two areas are large plexuses of the body. Lisch nodules, bumps under the skin, which can be called neurofibromas, bone deformities, larger than average head size, short stature. And then for NF2, gradual hearing loss, ringing in the ear, poor balance, headaches, facial droop, vision problems, and balance difficulties. These symptoms typically come from the acoustic neuromas and vestibular schwannomas. So moving on to diagnosis of NF1 and NF2. For NF1, the presence of symptoms are typically what they use to diagnose. There's really no test that they can run that can for sure tell you whether or not you have it. So in that case, they use criteria such as 6 or more café au lait spots, 2 or more fibromas, freckling under the arms, 2 or more Lisch nodules, and a parent or sibling who has been diagnosed. Another alternative test, I guess you could say, for this would be just getting a genetic test done, which is also a way to diagnose NF2. And then to continue with NF2, just like NF1, they usually just use your present symptoms to try to diagnose. So now treatment of NF1 and NF2. So for NF1, surgical removal of the fibroneuromas is a possibility. Chemotherapy to target some of the abnormal growths. Radiation is not recommended, though, for NF1. For NF2, typically people with NF2 have regular checkups to make sure that the development of the tumors isn't impeding their everyday living, such as balance or hearing, things like that. Radiation therapy is an option for NF2. Chemotherapy is an option. And then if it comes down to it, surgical intervention is always a possibility. Prognosis for NF1 and NF2, like most diseases, it varies from person to person and how exactly it's affecting them. But for NF1, the most common cause of death includes hypertension and spinal cord tumors. For NF2, it depends on the location of the tumor, the size of the tumor, the number, and how quickly the tumor was treated. So moving on to incidence and prevalence. So for NF1, has an incidence about 1 in every 2,600 to 3,000, and for the prevalence, 1 in every 3,000. And about 1/2 of the cases are inherited. So like I said before, inherited trait comes from the paternal dominant gene. For NF2, has an incidence of 1 in every 37,000, and for NF2, the prevalence, 1 in every 60,000. So for NF2, it's about 70% of people have skin tumors, and you can see very clearly that NF2 is a lot more rare than NF1. Okay, so the last slide talks about associations and support groups for neurofibromatosis. One could be found in New York, which is the Children's Tumor Foundation. Another possibility is London, which is the Nerve Tumors of UK. The Neurofibromatosis Network in Wheaton, Illinois. And lastly, the Tumor Foundation of BC in Vancouver, Canada.